Okay, folks, this is part 4. We're turning now to chapter 15 and treatments, therapies. So, first up, how are psychological disorders treated? In the modern era, there are still no instant cures for psychological disorders. And it's true that some treatments work better than others. And it's true that some disorders are more treatable than others. So, there's going to be some kind of range here. So, we're going to look at a few different categories of modern day therapies: psychotherapy, behavioral and cognitive therapies, and biological therapies. So, starting with psychotherapy, it's a psychological intervention designed to help people resolve emotional, behavioral, interpersonal problems and improve the quality of their lives, usually through talk, right? So, it's a kind of talk therapy. And a lot of psychotherapists have what we call an eclectic approach. Eclectic means like a lot sort of wide-ranging tastes, right? So they're going to use treatments that sort of pull from a bunch of different approaches. So we kind of pretend when we teach this stuff that there are behaviorist therapists and there are kind of talk therapists, when in fact, a given therapist might have a lot of tools in their toolkit and use different ones for different clients, right? Tailoring the therapy to the client's needs. So we're going to look at two categories of psychotherapy: psychodynamic psychotherapy and humanistic therapy. So starting with psychodynamic therapy. So the psychodynamic therapist believes that abnormal behaviors, problematic behaviors, come from adverse childhood experiences. That, all this stuff has its roots in childhood, perhaps through experiencing abuse or neglect, or a household that is dysfunctional in some way, or some combination of these, right? So the psychodynamic therapist is interested in analyzing the client's thoughts, feelings, wishes, fantasies, significant experiences from their life, and they're also going to explore the nature of the relationship that develops between the client and the therapist. The psychodynamic therapist believes that symptoms will resolve when clients gain insight into material that was previously unconscious, right? So the idea here is once the client realizes what caused them to be this way, that realization is somehow healing, right? Once they know why they're this way, they can stop being this way. So the first form of psychotherapy was Freud's psychoanalysis, right? And the goal here is to help people feel less guilty and frustrated and to make unconscious conflicts conscious, right? So pulling up the stuff that's dwelling in the unconscious mind so that the person can consciously acknowledge it and therefore heal. Okay, so bringing to awareness previously repressed, which means unconscious, impulses, conflicts, and memories. That awareness is called insight, right? Once you realize, oh, this is why I'm this way, that's insight. So sometimes this is called insight therapy, right? So how do you pull stuff from the unconscious? It's hard to sort of get in there, right? Because by definition, you can't just ask the patient, hey, what's in your unconscious mind? So Freud developed some techniques, including free association. So this is where the client lies back on that famous couch and is instructed to just start talking and to not censor whatever they're saying. So anything that comes to mind, say it out loud, right? And the hope there is that eventually stuff will start to bubble up from the unconscious and become part of what the person is speaking. Excuse me. Another technique he developed is dream analysis. Freud believed that whatever's going on in your unconscious mind, it can express itself in your dreams in a symbolic, encrypted way, right? So one road to the unconscious, in fact, he called it the royal road to the unconscious, is through dreams. So Freud spent a lot of time and energy analyzing people's dreams. He had a whole system for like, what do things in dreams really mean, right? The symbols in dreams. And so the therapist interprets the real meaning of the dream by decoding it. Okay, so that's psychoanalysis. Humanistic therapy, the purpose here is to help people learn to understand themselves and their goals and to support them in fulfilling their potential for personal growth. So one of the best known humanistic approaches is the first one, client-centered therapy, developed by Carl Rogers, who kind of invented the humanistic perspective, right? As a reaction against Freud and behaviorism, right? He said, I don't believe we have to go digging around in the unconscious to figure out what's going on with people and to help them. I think we can, help people by helping them accept who they really are, figure out who they really are, and accept who they really are. So, for this kind of therapy, the key is to create a safe, comforting, welcoming setting in which the client can figure out what they're really feeling and thinking and sort of figure out who they really are. So, a big part of doing that, creating that welcoming, safe space, is active listening. So, the therapist listens and then repeats the client's concern and asks for clarification when necessary, right? So here's an example. Let's say the client comes in, sits down, and says, I have had the worst week of my life. The therapist might say back, you've had a tough week. That's just repeating what they said, like in your own words, right? But what that does is it tells the client that they've been heard and it invites them to elaborate, right? And it conveys empathy. It shows that the therapist is listening and understanding. So active listening, which by the way, you can cultivate as a tool, right? You can use this in your conversations with people you care about. If your spouse comes home and says, I've had the worst day, instead of jumping in with, you think your day was bad, let me tell you what happened to me, which is what a lot of people do, you might just say back to them, you've had a tough one, right? Which invites them to say more instead of shutting them down. Try it. It's magic. It's relationship magic. Another important component of creating that safe environment is unconditional positive regard. That is like conveying the message to the client that I'm going to accept you and like you no matter what you tell me in here, right? I will accept your feelings. I will accept everything about you, right? So you can be honest. You can be open. You don't have to hide anything. And that can be a healing environment. It'll allow the person to figure out who they really are, right? Because it's the opposite of conditions of worth. And if you remember back to our previous module 6, we were talking about how, according to Rogers, that's the reason why people are miserable, is they grew up under conditions of worth, feeling like they have to be a certain way in order to be loved and lovable. This is counteracting that. It's saying, just the way you are, you're absolutely fine. Okay, so we got psychotherapy with Freud's psychoanalysis, and we've got humanistic therapy along the lines of Rogers, active listening and unconditional positive regard. Okay, let's turn now to behavioral and cognitive treatments, where the goal here is very pragmatic. The concern isn't so much, how did you get this way, which is what the psychotherapy is all about. The goal here is, let's identify the things that are causing you grief and let's fix them, right? Without having to worry too much about, how come you ended up this way? So with behavior therapy, maladaptive behaviors, that is behaviors that are causing harm in the person's life, can be replaced with adaptive ones through, guess what? Classical and operant conditioning, right? So the idea here is to reinforce desirable behaviors, helpful behaviors, with things like praise or treats or other reinforcers, and ignoring or punishing undesirable behaviors with things, if you're talking about parents, for example, like grounding or timeouts. But of course, this can be parlayed into a kind of therapy, right? So for example, part of treatment for ADHD might involve reinforcing desirable behaviors by awarding the child stickers whenever they do the things they're supposed to do, right? So a sticker chart, which will encourage them to keep doing the things that eventually you want to have them doing habitually, right? It's helping to create new habits. You can also teach a desired behavior through modeling, where the therapist acts out the desired behavior. So if a client, for example, has an upcoming presentation they have to give at work and they're really freaking out about it, maybe they can go watch, their therapist give a speech, right? Or somebody else give a speech, and then, learn by watching. And then, of course, part of the toolkit here is going to be rehearsing and role playing, right? So, you know, um, have the client give the speech to you as the therapist, right? Or if the client has issues with, I don't know how to meet people, I don't know how to introduce myself to people, I'm lonely, I don't have any friends, then you could sort of help them by role playing, scenarios where they have to come up and initiate a conversation with you, right? To help teach and establish new ways of interacting. Notice that what's absent here is any effort to figure out how they got this way, right? It's just like, we're going to fix the problem and not worry about why you have the problem in the first place. Cognitive therapy, the goal here is to modify the distorted thoughts that are producing the maladaptive behaviors and emotions, right? So again, it's about, let's just fix the problem, right? Like the problem here is that you're thinking about yourself and the world incorrectly. So let's set up new habits of thinking, right? So for example, a maladaptive pattern, my boss yelled at me, therefore I'm worthless, leading to feelings of depression. A more adaptive pattern after cognitive restructuring, that is learning how to think about it differently. My boss yelled at me, boss is having a bad day, no depression, right? Same thing happens, but you think about it differently and it leads to different outcomes. So here's a couple of cognitive approaches. First up is Albert Ellis's rational emotive therapy. So this is going back to the 50s. The therapist acts here as a teacher, explaining the mistakes the client is making in the way that they're thinking and demonstrating more adaptive ways to think and feel. So Ellis would challenge the person's statements, right? If the client comes in and says, I'm never going to make any friends, I'm just not likable, Ellis would say, well, let's test that, right? Are you sure you're not likable? What makes you think that? Like, let's gather some evidence here. So the idea is our vulnerability to psychological disturbance, anxiety, depression, etc., is the product of the frequency and strength of our irrational beliefs, right? Ellis says it's all about the way you interpret the world around you. So, for example, if you engage in catastrophic thinking, seeing everything as disaster, then guess what? You're going to be anxious. So maybe don't think that way anymore. Right? And so learning how to think differently. Similarly, we got Aaron Beck's cognitive restructuring. So this involves, again, directly challenging those negative thoughts that the client has about themselves and their situation and their future. The therapy focusing on helping the client recognize those distorted thought patterns and learning how to replace them with more realistic ones, right? So instead of, saying, I'm such an idiot, I'm so stupid, how could I have done that? Recognizing, oh, I'm doing that again, and nipping it in the bud. Wait a minute, I'm not an idiot. I should stop calling myself an idiot. I'm not stupid. This isn't all my fault, right? So checking those tendencies to run away with negative thoughts. Then we got cognitive behavioral therapy, which is where you take some behavioral therapy and some cognitive therapy and you add them together to create a very powerful and often very effective form of therapy, CBT, cognitive behavioral therapy. So the goal is to correct the faulty thinking, that's the cognitive piece, and to train the person to engage in new behaviors, that's the behavioral piece. So this is really good for anxiety disorders and mood disorders. Depression is often treated with cognitive behavioral therapy plus, say, an antidepressant medication. These work really well together, and the research shows they work better than either one by themselves. So, for example, if a client has social anxiety disorder, right, they think nobody's going to like them, they're afraid to meet people, the therapist will encourage them to examine other people's reactions to them and understand how they might be wrong about how other people view them. And at the same time, they can teach the client how to interact with people. Like, let's practice talking to people. Okay, so these terms here, behavior therapy, which involves reinforcement, modeling, role-playing, rehearsal, cognitive therapy with Ellis and Beck, and then cognitive behavioral therapy, where you smoosh together components of behavioral and cognitive therapy to create this super powerful hybrid. Okay, I am going to pause here and we'll pick it up in the next one.